Hello, my name is Shaleen Sulway, and I'm a physiotherapist with advanced training in dizziness and balance disorders. For the last 10 years, I have been part of the multidisciplinary team at the Hertz Clinic for Meniere's disease and vestibular dysfunction, and I also co direct Vestibular Health, which is a vestibular physiotherapy clinic at the Toronto General Hospital. Today, I will be talking to you about dizziness after concussions and how vestibular physiotherapy can help with treatment. Now, dizziness after a head injury can be experienced by up to 80% of people. Dizziness and unsteadiness is the second most commonly reported symptom after headaches, so it is fairly common. Now, there are three words we hear quite commonly, and I want to take a minute to define these. Dizziness, this is a very non-specific term that means different things to different people. So if you were to come into any of our clinics, we would always say if you couldn't use the word dizziness, how would you describe your symptoms? Some people say it's a sense of spinning. Some people describe it as a sense of lightheadedness, rocking or swaying, floating, disequilibrium, discombobulated. Vertigo, on the other hand, is a very specific type of dizziness. It is the illusion that you or the environment is moving when you are actually not. Often it has a rotational or spinning component, but there can be a tilting feeling or a feeling of bobbing or moving up and down. Lastly, disequilibrium. This is a sense of unsteadiness or imbalance that is often accompanied by spatial disorientation, and it's often made worse with head movements. Now, all three of these symptoms are related to the vestibular system, but they have very different meanings, and describing them accurately can make a big difference when it comes time to making a successful diagnosis and treatment. So let's talk about the vestibular system a little bit more. The vestibular system includes the balance organs in the ear, the eighth cranial nerve, which is the vestibular nerve, and then parts of the brain that process those vestibular signals, your brainstem and your cerebellum. So if we look at these balance organs, they are in the inner ear, deep inside, encased in temporal bone. Their job is to sense movement of the head, sense gravity, and acceleration. So they help us to maintain three major functions in our body. They maintain posture and balance. They allow us to see the world clearly when the head is moving, and they provide us with spatial orientation. So they regulate our body's movement through space and allow us to have awareness of that movement. Now, the susceptibility of the inner ear to trauma is not surprising. Since these vestibular structures are surrounded by bone, they are subject to the forces on the head. There also can be direct injury to the nerve or also parts of the brain that process the balance information from the ear. So if these organs are functioning well, we will have normal balance, we'll have normal vision when we're moving, and there will be no dizziness. But it's when these organs don't work well that we start to see some of these symptoms. So we'll go over the top three symptoms. First one, vertigo and dizziness. This may be triggered by change in position. It can be triggered with movement, especially movements of the head. It can be sometimes spontaneous in onset. Now, depending on the cause, it can last seconds, minutes, hours, and in some cases be constant. And it's often associated with nausea and vomiting and unsteadiness. And it can have other ear symptoms associated with it, like ringing, fullness, or hearing fluctuation or hearing loss. One of the most common presentations of vertigo in adults is a condition called benign paroxysmal positional vertigo. We call it BPPV for short. It's characterized by recurring episodes of vertigo that are short, so usually less than 60 seconds, and they are almost always triggered by changes in head position relative to gravity. So if you bend forward and come up, you lie down, look up, or roll over, it can trigger the vertigo. It usually does not occur if you are sitting still. It's associated with nausea, vomiting, imbalance, and it tends to respond quite well to treatment. So let's look at what would happen in benign positional vertigo. This organ here, this is a gravity receptor called the utricle. And the utricle, if we look at the hair cells in the utricle, they are down here. They're topped with a jelly-like substance. And on top of that are small little calcium carbonate crystals. So these are a normal part of our hair, of our anatomy. And because of a concussive force, these crystals can become dislodged. And if they get dislodged, you can see all these three semicircular canals, they are connected to the utricle. So they can start to go into the semicircular canals. Now, if we move our head, the crystals in these canals can move. That will send false signals to the brain, and that will trigger the vertigo and the imbalance that comes with it. So, what we do in physiotherapy, the goal is to clear the crystals out of the canal. First of all, figure out where these crystals are, which canal, and then send them back into the utricle. Another symptom that's quite common with vestibular disorders are imbalance. So, we commonly hear this line, people must think I'm drunk. So the imbalance typically is worse with movement. You're generally okay if you're sitting still, and the balance can worsen with head movements. People find it more difficult in the dark and on uneven ground, and there's a sense of losing control or having a fear of falling. Visual symptoms are another common presentation. You can have blurry vision or difficulty focusing with head movements. You may feel your eyes don't keep up with your head. If you move your head, there's a bit of a lag in vision. The horizon might be oscillating or bobbing when you're walking. And a lot of people also develop dizziness or intolerance to visual stimulation. So, such as reading, scrolling on a computer or telephone, driving, being in grocery stores. All of these can trigger the dizziness. So, if you do have dizziness after a head injury, you can see a physiotherapist with advanced training in vestibular rehabilitation. The assessment usually includes a detailed history to help us narrow down some of the common causes of dizziness and a physical examination where we look at your inner ear balance organs, we look for positional vertigo, we look at the parts of the brain that control balance, visual symptoms, balance and gait, and overall we want to understand how your dizziness is affecting your function and how it's limiting you. Our treatments are aimed to reduce the dizziness, improve balance, and improve visual symptoms, and are very individualized. So, if you did have benign positional vertigo, our goal would be to reposition those crystals back to the utricle with various maneuvers and try and normalize your balance after that. If you had loss of vestibular activity, we would develop an exercise program to promote central nervous system compensation. And if you had visual symptoms, we would work on reweighting the sensory system. So decreasing that visual dependence and using habituation exercises to reduce the symptoms. But our overall goal is to have you return to normal function without symptom interference. So I'll close off today with some take home messages. I want you to know that dizziness is a common symptom after concussions and is often accompanied by balance impairments and visual symptoms. The initial presentation of dizziness is an important clinical finding and should be evaluated further with vestibular imbalance testing. BPPV is the most common inner ear disorder and responds well to treatment. And I encourage you to speak to your doctor if you have dizziness, or feel free to contact us for a short phone consultation to see if vestibular physiotherapy is right for your symptoms. Thank you very much for your time.